Hi, I'm Frank Chow, an occupational psychiatrist in Sydney and the director to Health. Mental health injuries are often complex and challenging and is becoming more common in our modern workplace. There are often a number of complex factors the clinician needs to consider when faced with such presentations. Having been involved in treating and assessing a number of patients with psychiatric injury for a number of years, I have decided to create an educational program for clinicians related to psychiatric injury. Introducing to Health mental health education program for clinicians. There are 7 modules in the program. Through the first 4 modules, we will cover the common presentation of work-related mental health problems, the issues of diagnosis, the common causes, and the treatment. Being familiar with the common presentation and having a common understanding of the language of diagnosis are often an important first step in facilitating the recovery of an individual. Developing an understanding of the number of common causes of work-related mental health problems will therefore help the clinician direct the patient to the appropriate and effective treatment. The later 3 modules cover the complexity of the compensation system, the rehabilitation barriers, and the clinician role and mindset. Unfortunately, by the time a patient presents to their clinician, they're often at their crisis point. Their mental health condition is often severe with employment incapacity. Their workplace difficulties are often prolonged and complex. A certain number of patients may choose to go down the compensation pathway. It is important for clinicians to have a better understanding of the legal and compensation system so that we as the clinician are in a better position to guide our patient during their recovery process. Sometimes rehabilitation can be challenging and difficult after psychiatric injury. Being aware of the possible barriers will help you feel more at ease when facilitating the patient through such difficult time. Finally, it's often a long process when helping our patient to recover from their psychiatric injury. During such prolonged process, we are exposed to the complexity of our patient workplace dynamic, patient's own personality and psychosocial issues, the different aspects within the compensation legal system, and the rehabilitation process. Having a good understanding of our role and limitation within such complex process is really important not only for the clinician's own well-being, but also for sustainability purpose. Whether you are a general practitioner, psychologist, rehab provider, or case manager, this information will better assist you helping your patient to recover from their psychiatric injury. For further information, please contact me directly on the number below and I'll get back to you to further assist with your inquiry. Thank you.